Type 2 diabetes is a disorder in which the body cannot use the energy from the food you eat. Your pancreas generates insulin to facilitate glucose used by your cells. But as time passes, the pancreas produces less insulin, and the cells develop insulin resistance. This produces an excessive accumulation of sugar in the blood. Type 2 diabetes may result in major health complications, including heart disease, stroke, and even death. Welcome to part 3 of our 4-part series on diabetes. In this video, we are going to discuss type 2 diabetes, the symptoms, causes, diagnosis, testing, and everything else you need to know about this chronic disease. Before we continue, you can find the links to part 1 and 2 in the description below. Type 2 diabetes is the most prevalent form of the disease. Approximately 1 in 10 Americans are affected, and it ranks as the 7th biggest cause of death in America. What are the symptoms of type 2 diabetes? Type 2 diabetes symptoms tend to develop gradually over time. They may consist of visual impairment, fatigue, feeling intense hunger and thirst, increased and frequent urination, often during the night, slow healing of wounds and cuts, numbness or tingling in the hands or feet, and undiagnosed weight loss. What are the adverse effects of high blood sugar? Consequences of type 2 diabetes with high blood sugar levels include problems in digestion, including gastroparesis, vision issues, including diabetic retinopathy, problems with the feet, including leg and foot ulcers, periodontal disease and other oral issues, hearing impairment, cardiac disease, renal disease, problems with the liver, especially non-alcoholic fatty liver disease, perivascular neuropathy or nerve damage, skin disorders, stroke and infections of the urinary tract and bladder. Rarely, type 2 diabetes leads to a disease known as ketoacidosis, associated to diabetes. DKA is a potentially fatal disorder in which the blood becomes acidic. People with type 1 diabetes are more prone to develop DKA. Why does type 2 diabetes occur? When the pancreas produces less insulin than the body requires, and cells cease reacting to insulin, they consume less sugar than they should. Sugar then accumulates in the bloodstream. Insulin resistance is the lack of response of cells to insulin. Typically, it is caused by lifestyle variables, such as obesity, a lack of physical activity, genetics, or defective genes. How is diabetes type 2 diagnosed? The following blood tests assist your doctor in diagnosing diabetes. Fasting plasma glucose test determines your blood sugar level. This test is best administered at the workplace after an 8-hour fast in the morning. Random plasma glucose test. This laboratory test may be performed at any time without fasting. A1C test determines your average blood glucose levels over a 3-month period. Oral glucose tolerance testing. This test measures your blood sugar levels before and after the consumption of a sugary beverage. The test analyzes your body's glucose metabolism. Luckily, type 2 diabetes can be managed through medication and lifestyle changes. There is no known cure for type 2 diabetes. However, you may control the disease by living a healthy lifestyle and, if necessary, taking medicine and collaborating with your healthcare provider with respect to your blood sugar. A blood glucose meter or continuous glucose monitoring may assist you in achieving your blood sugar goal. In addition to frequent A1C testing, your healthcare professional may suggest oral drugs, insulin treatment, or injectable non-insulin diabetic medications. Your blood pressure. Reduce your blood pressure by quitting smoking, engaging in regular exercise, and consuming a balanced diet. Your doctor may prescribe blood pressure medications like beta blockers or ACE inhibitors. And your cholesterol. Adopt a diet reduced in saturated fats, trans fats, sodium, and sugar. Your healthcare professional may suggest statins, a cholesterol-lowering medication. What should a meal plan for type 2 diabetes include? Ask your healthcare practitioner or nutritionist to suggest an appropriate food plan. In general, A meal plan for type 2 diabetes should include lean proteins. Chicken, eggs, and shellfish are examples of lean proteins low in saturated fat. Proteins derived from plants include tofu, almonds, and beans. Minimally processed carbohydrates. Refined carbohydrates such as white bread, pasta, and potatoes may produce a rapid rise in blood sugar. Choose carbohydrates that generate a more gradual rise in blood sugar, such as oatmeal, brown rice, and whole wheat pasta. No added salt. An excessive amount of sodium or salt may elevate blood pressure. Avoid processed foods such as those in cans and packages to reduce your salt intake. Choose salt-free seasonings and substitute healthy oils for salad dressing. No added sugars. Avoid sugary meals and beverages such as pastries, cakes, and sodas. Choose to drink water or unsweetened tea. Non-starchy vegetables. These vegetables have fewer carbs, therefore they do not produce blood sugar rises. Broccoli, carrots, and cauliflower are examples. If you have type 2 diabetes, would you require medicine or insulin? In addition to diet and exercise, some people may use medication to treat diabetes. Your physician may suggest oral diabetic medicines. These are tablets or liquids that can be consumed orally. For instance, the drug metformin helps regulate the amount of glucose your liver generates. Insulin may also help the body use sugar more effectively. Insulin is available in the following methods. Self-administered injectable insulin is administered by injection. Most people inject insulin into a fleshy area of the body, such as the abdomen. Insulin is provided in both a vial and an insulin pen. Insulin that is breathed is inhaled through the mouth. It is exclusively offered in a rapid-acting formulation. Insulin pumps constantly administer insulin, just like a functioning pancreas would. Pumps inject insulin into the body through a small, thin, flexible tube. Pumps are connected to a computerized device that controls insulin dosage and frequency. Living with type 2 diabetes entails constant vigilance in recognizing the more serious symptoms and when you need medical assistance. It is essential to constantly monitor diabetes if you're ill. Even a slight flu might be hazardous if it affects your insulin and blood sugar levels. Create a sick day plan with your healthcare provider so you know how often to monitor your blood sugar and which medicines to take. Immediately contact your physician if you experience disorientation or memory loss, fever of at least 100 degrees Fahrenheit, blood sugar levels above normal for more than 24 hours, nausea and vomiting lasting over 4 hours, difficulty with balance or coordination, severe pain in any part of the body, or you are unable to move your arms or legs. If you have type 2 diabetes, your prognosis will be determined by how effectively you control the amount of glucose in your blood. Type 2 diabetes, if left untreated, may cause a variety of other health concerns that are life-threatening. Diabetes needs lifetime control. What are the key differences between diabetes type 1 and type 2 diabetes? Type 2 diabetes is distinct from type 1 diabetes. In type 1 diabetes, the pancreas is unable to produce any insulin for the patient. When you have type 2 diabetes, your pancreas does not produce enough insulin, and the insulin that it does produce does not always function as well as it should. Both kinds of diabetes are classified as forms of diabetes mellitus, which indicates that they cause hyperglycemia, also known as high blood sugar. Type 2 diabetes often affects people in their later years. Nevertheless, it is becoming increasingly prevalent in younger age groups. Type 1 diabetes more often affects children and young adults. However, anybody of any age may be diagnosed with the condition. Who should be concerned about the possibility of having type 2 diabetes? If any of the following apply to you, you have an increased risk of developing type 2 diabetes. You are a member of the African, Hispanic, Native American, Asian American, or Pacific Islander ethnic groups. You are older than 45 years of age, being classified as overweight or obese, not exercising, being diagnosed with gestational diabetes while pregnant, having a history of diabetes in your family, you either have excessive blood pressure or the beginning stages of diabetes. Before we continue, just a reminder to subscribe and hit the notification bell to get a notification for the last part of our series. In Part 4, we will be discussing prevention, maintenance, and possible reversal of diabetes. There are several types of diabetes, each requiring unique care and treatment protocols. Those with a family history of heart disease or type 2 diabetes must alter their lifestyle to lower their chance of getting diabetes and its consequences. Weight reduction, a good diet, physical activity, and quitting smoking are crucial things to follow. If you are having symptoms and feel you may have diabetes, it is imperative that you get medical assistance immediately. The treatment and management of diabetes differ by type. Nonetheless, all diabetics might benefit from the advice of a diabetes care and education professional. These professionals may assist in alleviating the burden of this condition by giving guidance and assistance. Despite the possibility of long-term problems, people with diabetes may live long, healthy lives if they maintain effective diabetic management. We hope you enjoyed the video. Until next time, thanks for watching.